Hi, my name is Dr. Brian Ardis, and this is the Dr. Ardis Show live on Tuesday night. We would like to thank all 4 of the audience members from last week. We had a fabulous turnout and lots of questions. It was amazing. And I got to meet the 4th person who logged into that show in Kansas this last weekend when myself and Dr. Peter McCullough were there doing like 6 hours of talking each. It was fantastic. All right, so tonight's show is we're going to be discussing blood clots, and we're going to talk about why. I will talk about that here in a second. We're going to do that. And I've got Dr. Thomas E. Levy. He's live with us out of Miami, and he's going to help educate the audiences on blood clotting, why that's a concern, and then, educate you on the topics that I'm going to be relating to why this is so important. All right, so first sponsor for the Dr. Ardis Show tonight is the NorthTexasHealingCenter.com. As you see on the screen, it is NorthTexasHealingCenter.com. They're in Frisco, Texas. Their phone number is 214-705-9369. They actually specialize in looking for the underlying causes for symptoms and disease, and they use modalities and therapies like chiropractic, emotional release technique. They use nutrition response technique and autonomic response technique. Contact them today at NorthTexasHealingCenter.com. Second sponsor for the show is Mike Lindell's MyPillow. Go there and buy something for your house and use the promo code DOCTOR. They will promote and populate additional savings or percentages off, even up to 66% off of something you might select there. Supposedly, the slippers are phenomenal. Dr. Sherry Timpany, I was on her show the other day. She said they come a little small, so get a size a little bit bigger than what you typically wear, and they fit perfect. She says they're amazing. All right. That's the Dr. Ardis Show, my pillow sponsor. Use the promo code DOCTOR. I want to welcome to the audience, the live audience, all 5 of you. We've exponentially grown this week. Thomas E. Levy. Welcome to the show. Say hi to the group.
Hello, all. Glad to be here.
You're in Miami. Is it still light there?
Oh, no. It's it's 8:30 here. No, it's quite dark.
Okay, it's dark. All right, so I want you to tell me what you did today.
Well, mostly I did a little writing, did a little reading, and ate some good food. That was about it.
Awesome. What's your favorite food to eat, Dr. Levy?
Ooh, that's a tough one. Any way you can prepare shrimp.
Oh, I love shrimp. So you're more
especially if you're in Cajun country and in New Orleans.
Oh, so you have an affinity to like Bubba and Forrest Gump. Remember all his favorite ways of shrimp?
Yeah, I never ate quite that many different forms of shrimp, but the forms I ate were delicious. I mean, anybody that talks about wonderful food and doesn't mention New Orleans is really missing the premier spot, in my opinion. I probably spent about 14 or 15 years there.
That's awesome. All of my relatives, my parents, grandparents, aunts, and uncles, they're all from Metairie, right outside of New Orleans. Yep. So I spent my whole life going to Metairie for every holiday, every Mardi Gras, every summer was spent in Metairie. And now most of my family's around Slidell, Covington, Laplace, everywhere around Lake Pontchartrain. And that's where we call home, because that's where all of our grandparents were.
I don't need to tell you about the food there, do I?
Oh, no, you don't. You and I just need to meet there. And I think you told me that you're going to be in Louisiana, right? Next month, maybe in March?
Yeah, 3rd, 4th, 5th.
Yep. And what are you doing there?
It's the IAOMT conference.
No one in my audience knows what that means.
International Oral Medicine and Toxicology. McCullough will be there too.
Yeah, you and Dr. Peter McCullough. It's going to be great. You guys are going to be a great duo. 2 cardiologists on the panel, educating and inspiring the group. All right, so I want to ask you a question. My audience is dying to know, including myself. What form of shrimp is less stressful on the heart? What type of prepared shrimp? Is it fried, coconut fried, grilled, baked, sautéed, étouffée, gumbo? What is it?
Étouffée.
Yeah.
I mean, it's done right. I mean, it's like anything else. You get a dozen different people, they're going to come up with a dozen different things. But a good old Cajun chef, and even better than the shrimp étouffée is the crawfish étouffée.
Oh, so you're not kidding.
If it were readily available and always fresh, I think the most versatile eating is with crawfish. You could do so many things with them, and they're basically tastier than shrimp.
My kids have been asking for I have 5 kids, like multiple of them been asking the last month, when does crawfish season start, Dad? We want crawfish. It's coming up towards the end of this month. It's going to be phenomenal. All right, so Thomas E. Levy, there's a couple things, and one of the reasons I wanted to invite you tonight and thank you for coming on is I was actually reading some research articles this last weekend, and these research articles were put together by an individual and then published into an email list of all of us who are involved in educating, gathering research, sharing information and data surrounding COVID, worries about infections, protocols, vaccinations, you name it. And one of the things that kept coming up was information about how spike proteins, either related to SARS-CoV-2 or by itself, or being generated by the vaccines, was triggering these effects of blood clot issues. I personally know very well Dr. Ryan Cole out of Idaho. He's a pathologist, and he has been actually telling the world that under the microscope, he is finding micro blood clotting throughout most of the tissues of bodies of people post getting vaccinated, even after they've passed away. And this could be one of the complicating factors. So I thought it might be of benefit to a lot of people who are now still being exposed, supposedly, and contracting variants of SARS-CoV-2 that carries the spike protein, and the worries that 99% of all COVID-19 cases per the CDC this week was Omicron variant. And now you've got the vaccines continuing to be pushed. I thought it might be important to actually bring to light and educate the audiences on, and using a cardiologist like yourself to do it, to explain blood clotting. What are blood clots? You'll hear the term thrombotic episodes is what we see in papers. But I want our audiences to learn from you some of the aspects about blood clotting, what you might look for as a cardiologist. What are some symptoms related to blood clotting that patients may need to be concerned about and look at? And then I want to wrap this up and go to the direction of, we have some research papers and publications, and there are specific vitamins, minerals, and other things that have been proven to help beneficial with the thickening of blood. And anyway, so let's get to it. Can you talk about the aspects of the blood that cause blood clotting? Can you do that for us, cardiologists?
Well, they have a big coagulation mechanism in the blood. When activated, a whole series of things. One triggers the next, and finally you start congealing the blood. And basically, when you cut yourself and after a minute or so, the bleeding stops, it's the same thing that takes place in the vascular system, except that it shouldn't be taking place there. So it's a normal mechanism occurring in an abnormal place. Okay. Now, with regard to symptoms, blood clotting is going to really do two big things. It's going to stop the perfusion or the flow of blood where most of the blood clots are, and this causes a loss of oxygen carrying to the tissue that was going in there, known as ischemia. And you're going to have a less efficient carrying of the oxygen, because usually the oxygen is being carried by the blood, and if the blood is contained in a clot, you're no longer getting carried there. But bottom line is, you can have just about any symptom in the book depending on where the blood clotting is taking place. Now, most commonly, it occurs in venous areas, venous stasis, people that have poor blood flow in their legs, you get blood clots. In the setting of COVID, post-vaccinations, other things like that, we're seeing an inordinate amount of clotting of the blood in the pulmonary, in the lungs. And this is one of the reasons, and probably an underappreciated reason, why some people just start right up with shortness of breath when they get the COVID, is because they uniquely were susceptible to activating the blood clotting mechanisms inside their lungs due to the spike protein, as you talked about. The devil of the spike protein is, it appears, it's given by the vaccine. That's the whole point of the vaccine: give you spike protein, and then have the spike protein get in by binding the ACE2 receptors at a different area of the body, and then start replicating and mount an immune reaction. And that's what it does when you're infected with COVID. Except when you're infected with COVID, the spike protein is attached to the entire virus, and then you start replicating virus. The problem is the persistence of the spike protein. Now, for whatever reason, the spike protein, in addition to causing problems by blocking these ACE receptors that should normally be doing another function entirely, the spike protein is a toxin, okay, and it has toxic effects. However, what makes it a really nasty form of toxin is there really aren't any toxins to speak of that have a way of replicating themselves. I mean, if you get a dose of poison, you have that dose and that's it. You don't have the poison going inside your body and then managing to reproduce itself and continue to produce more poison. Yes, that's exactly the case of what's happening with spike protein. And this, in my opinion, is the most important thing now that we're facing, and many, many people are facing this in the form of what's called long haul or chronic COVID, and anybody having any problems at all after their vaccine. Virtually all of it, I believe, is due to persistence of the spike protein. And the also devil of it all is the spike protein is not going in 10 different people going to uh, cause the same problem. Some of them, we're talking about the blood clotting, they attack the ACE receptors inside the blood vessels. Uh, some of the people that have problem breathing but don't have blood clots, they're attacking the ACE receptors on the cells, the epithelial cells lining the lungs. And with myocarditis and pericarditis, those systems. So you have and people are having brain fog. So it's going into the brain everywhere. You name it, it goes there. But the important thing, and I think we're only realizing it now, and we're not realizing it, I think, avidly enough, is when you're finished with COVID and you've gotten over it, you should be well. All right. There are people that are over the acute phase, but just staying fatigued, fogginess in the brain, very little energy, a wide variety of aches and pains and headaches, and you name it. And the same thing with some individuals after their vaccine. Now, what I think is a very practical thing to do is they have a test called the D-dimer test. It's very, very sensitive. If you have abnormal blood clotting taking place anywhere in your body, your D-dimer test is going to be elevated. I mean, there might be other things that would cause it, but in the setting of post-COVID, if you have an elevated D-dimer, you still have blood clots that are forming and blood clots that are dissolving. And this has to stop. Okay, this is ultimately what's going to cause so many long-term problems because, as I just said, when you're clotting the blood, you're not getting oxygenation, different tissues start to get ischemic and die, and you get the whole complication. So, number one is anybody that's not feeling that well absolutely has to have the D-dimer test. Now, the D-dimer test is, if it's positive, if it's above the 0.5 level, you need to take measures to vigorously neutralize the spike protein, break it down and metabolize it. And all this comes down to the good old vitamin C. Now, it's probably beyond the time that we have here, but let me tell you in a quick nutshell, the vitamin C is the primary source of energy in your cells. Okay, you get enough vitamin C, everything in the cell runs correctly. The other thing too, vitamin C is an antioxidant, and the spike protein and any other toxin is a pro-oxidant. It takes electrons away from biomolecules, causing the damage. The oxidation of the different biomolecules is the damage. And when you bring in large amounts of vitamin C, you not only repair that damage, but you also process the spike protein. And it would appear, when combined with other biooxidative therapies, like different variations of ozone, hyperbaric oxygen treatment, ultraviolet blood irradiation, all of these things, and even hydrogen peroxide, not only by nebulization, but by proper intravenous administration. It's not even appreciated today, but in the 1918 flu epidemic that killed millions of people, I believe, a large number of doctors were aware of hydrogen peroxide and started peroxide infusions on a large group of patients that were near death. And even at that point in time, it saved 80% of those patients. Wow. So the point is you have to break down the spike protein. You have to stop its production. You have to eliminate it from the body, and you have to repair the damage. And when it's all done, you need to document that there's no ongoing thrombotic damage, which is reflected by the D dimer. And there's a lot of things that can go wrong, but I can tell you this, in my own personal experience, I found I was in the middle of my COVID, for example, and I had very little taste, but I wanted to give myself an IV push. I'm not advising people to do this, but it's something I do for myself with a butterfly, self-administered, a large IV push of vitamin C. I was going to give myself 25 grams over a few minutes. Okay, and I always like to have a beverage with me. So I had my root beer, and even though I could barely taste the root beer, I still get thirsty when I'm doing this. So I had it ready. I took a sip before I started, could barely taste the root beer. Then I started the butterfly and pushed the vitamin C as rapidly as I could tolerate it. And over about 3 or 4 minutes, I had probably pushed in 9 to 10 grams of vitamin C. I took another sip of the root beer, and it was full flavored. That quickly, the rapid administration of a high dose of vitamin C completely resolved, for the moment, that damage that was done to my taste. It recurred, so I needed to continue this for a while, but the point was made. The only thing that I did that went from no tasting to tasting full was the rapid administration of a high dose of vitamin C. So now, of course, that's not practical for everybody to do. If you have a physician that you can work with that is familiar with intravenous vitamin C, fine. But taking large amounts of oral vitamin C on a regular basis is good too. So in a nutshell, don't accept that feeling bad in any way after COVID is over is normal. You have to jump on that. And even if your D dimer is normal and you're pretty sure there's no clotting taking place, you still have to go with this vitamin C protocol that I recommend, because you need to repair the damage. You need to repair the widespread oxidative damage that was done throughout your body, because I don't think you'll ever get your energy back. You'll ever get your brain fog to appear. The electron debt, the oxidation debt has to be paid. You can't, let's say, take a pound of oxidation and make it go away with an ounce of antioxidation. You got to pay the piper, and you got to reverse that damage.
Amen. All right, so you did a whole review, which was phenomenal, and I want to bring the audience to the attention that one of the main reasons I even wanted you on this, there's a couple things. This guy that we're listening to right now, this cardiologist, board certified for 40 years, he created an incredible document that you can find on orthomolecular.org, orthomolecular.org, where it's actually titled Canceling the Spike Protein. The actual date that it was published is October 18th, 2021. So if you want to do a search engine, type in Thomas E. Levy, orthomolecular.org, and October 18th, 2021. And the document will come up. And the whole thing he writes about is what the spike protein is showing evidence and how it is causing spike proteins. And he went all by himself into the D-dimer test. And I have a few questions for you, Dr. Levy. This D-dimer test, which is an indicator that there's a massive amounts of blood clotting, I guess the more severe elevations of D-dimer, the more severe the blood clotting throughout the body. But I've actually had referenced, without looking at your paper, I've seen reports of 15 times the elevated amounts of D-dimer after the vaccines or after COVID, which would indicate a lot of blood clotting. So I would like you to tell the audiences for a D-dimer test for those people that have either myocarditis, long hauler symptoms, or a lot of fatigue and brain fog, like you mentioned, if these can be evidence of micro blood clotting, Where can they get a D-dimer test? Where do they go? LabCorp, Genova Labs? Where do they go?
LabCorp and lifeextensionfoundation.org. You can purchase the test there and get it drawn at a LabCorp. You don't need to see a physician to do it.
Okay, great.
I might say this too, and I want to emphasize this in case I didn't give it proper emphasis before, is obviously if you're feeling bad, you need to do more things. But I want to make the point that a lot of what COVID does is silent damage. It isn't necessarily symptomatic. So it's my opinion. This isn't anything I know that's written around, but if you've had COVID and you're over it, if you had a vaccination and you feel fine, I still think you should get at least one D-dimer test and make sure that's normal. Okay. In the paper that you mentioned that I wrote on the Orthomolecular Medicine News Service, those were two individuals who had had vaccinations who were feeling fine. One of them was the son of a physician who worked at his laboratory, and his father was just doing tests on other patients, and his son had had the vaccination 2 weeks earlier. And he said, well, why don't you check my blood? And in this case, it wasn't the D-dimer. They did dark field microscopy and saw that all the blood cells were stuck together. Now, obviously, under a microscope, sticking together the blood cells is basically the first step toward blood clotting. Sure. But even though the D-dimer wasn't checked, they did two things. They gave 15 grams of vitamin C intravenously, and they did what's called an ozonated saline infusion. And immediately after, the blood picture was completely normal. Furthermore, they rechecked it 2 weeks later, and it was still normal 2 weeks later. Now, that doesn't mean it's permanent, but it also means it has at least a significant long-lasting effect, giving some reassurance that the vitamin C and the ozone treatment not only immediately corrected the problem, but it knocked out the ongoing replication of the spike protein. So for asymptomatic patients, I recommend the D-dimer because most people will not be able to find a dark field microscopy physician. And definitely, my goodness, if you're having chest pain and you've been diagnosed with myocarditis and now you're starting to feel better again, don't assume that just because the pain finally went away and maybe most of your energy is coming back, that things are normal. I mean, I'm not trying to make people paranoid here, but it's becoming more and more and more obvious as time goes on. I mean, we're seeing statistics where I think one of the statistics was 40% more people died, not from COVID this year relative to last year. Now, maybe there's a lot of different things that could cause that, but I think one logical thing is damage was done and it set the stage for other diseases to come in and take over and then have a long-term negative effect on the mortality of the population. So bottom line is a lot of people say, oh, it's the China flu. No, this is a lot more than flu. Flu doesn't do this, influenza. It might be a virus too, but it's an entirely different mechanism, and the flu does not leave you with, as far as we know, any long-term damage once you get over it. Not the case with COVID, and not the case with some, I can't tell you how many or what percentage is, but some people that have received the vaccination, because the vaccination is the spike protein. That's the vaccination. And the COVID infection is replication of the virus with the spike protein. So unfortunately, for some people with a vaccination, the spike protein doesn't just initiate an immune response and then goes away. It keeps on propagating.
That is awesome. So thank you for explaining that. And I absolutely encourage everybody to go to orthomolecular.org and look at this paper from October 18th titled Canceling the Spike Protein. The actual images of those two patients he was referencing, they're in there. So you see the image before they did the high dose infusion of vitamin C and what was the ozone therapy? Is that what it was?
Ozonated saline, actually.
Ozonated saline solution. And then the after images. And it's amazing. There's what's called the Rolo formation. That's where they stack up on top of each other, all the cells. That's a New Orleans reference, right, Rolo? The way that ends with EAUX, it's got to be from New Orleans.
Exactly.
That's a French term, obviously. All right, now I want to go to some slides that we have here because not only do the shots we know and the spike proteins cause blood clotting, but you as a cardiologist will know this. We're going to go to the second slide here. There's something called deep vein thrombosis that affects 900,000 people in the United States, kills up to 100,000 every year. This is a big deal. So blood clotting can occur not only from getting infections, deep vein thrombosis. I remember learning this in school, that there's a lot of people that are truckers, long haulers, that can actually get these blood clot issues where a blood clot will form in the legs. And if that blood clot comes loose from there, it creates areas of symptoms in the legs where the clot is for sure. But if that clot moves, tell us where that thing can go, Dr. Levy, and what it can cause in the way of lung problems, heart problems.
Really bad deep vein thrombosis in the legs. As you say, at a certain point in time, when there's enough movement of the leg, the clot will break loose and make its way to the lungs. And if it's big enough, it blocks off enough of the blood supply to the lungs and it causes sudden death. In lesser circumstances, it'll shower down small, what's called emboli. Once the thrombus starts moving, it becomes an embolus, which is just a moving thrombus that's broken off. And when that occurs, depending on how many different areas of the lung is involved, you can have varying degrees of shortness of breath because you directly and immediately impair oxygenation throughout the body. So pulmonary embolism is nothing to mess with. But it's interesting that you bring that up because the pulmonary emboli that we're seeing in lots of cases of COVID is a completely different origin.
Show the next slide, Mark.
This is the more common source of pulmonary embolism in people, as you say, they're truckers, they're not moving their legs, they had increasing degrees of venous disease so that the veins enlarge and the blood vessel, the blood flow slows down. And all of those factors, slowing the blood, having irregular areas in the blood vessels, sitting in place for a long period of time so that the blood doesn't flow freely, all of those can predispose to blood clots. But of course, in the case of COVID and the spike protein coming from the vaccines, it's an entirely different etiology. They actually cause the blood clots to form directly in the blood vessels where these ACE inhibitors we've talked about get blocked.
And I have up on the screen some of the signs or symptoms you've been talking about this whole time related to blood clots of any kind. And you'll see them in relationship to pulmonary embolism. We want people to just understand that these are the signs and symptoms you should be looking for. If there's chest heaviness or pain, shortness of breath, like you mentioned, Dr. Levy, sweating, nausea, lightheadedness, weakness of the face, arms or legs, difficulty speaking. You mentioned brain fog and inability to have cognitive function, arm or leg, sudden or gradual pain. One thing about blood clots in the vein or in the deep parts of the legs, deep vein thrombosis, you'll see like increased heat around those areas of the body. That's one thing almost everybody complains about. Deep pain with it's hot to the touch. And then severe abdominal pain, vomiting, all kinds of stuff. Lungs with the pulmonary embolism, sharp chest pain, racing heart, shortness of breath, sweating, coughing up blood. None of those are good signs. All right, now if we could go down to the sixth slide here. Have you heard of the reports from Dr. Charles Hoff out of Canada, Dr. Levy, about him saying 62%, you brought up the D-dimers, but this is what he found in 62% of all the people that got mRNA vaccines in his area of Canada?
As a matter of fact, it was Dr. Charles Hoff that I don't know if this is the same article, but he published something probably close to, 9 months ago, maybe a year ago, where he was describing the same percentage right there that he found that 60% of his patients with COVID had elevated D-dimer tests. And quite honestly, that was the first time I ever heard of D-dimer. And then I did my due diligence and read up on it, and it made sense as to what was going on there. But no, and of course, what he's saying there is a different way of saying what I'm saying, which is if you don't get rid, neutralize, and eliminate from the body the ongoing spike protein presence. Yes, I mean, the body can heal to a certain degree, but if you keep on damaging, keep on damaging, keep on damaging, without really directly intervening appropriately, the body's going to develop any of a number of different diseases, quite similar to that pulmonary embolus symptom profile that you said. And these have to be addressed. And I have no doubt, like I just cited that statistic of the 40% increase in overall death unrelated to COVID, apparently unrelated to COVID. But these were people that did not die in the hospital of COVID, but they had that many more people dying. And that begs the question, why? Why? Okay. There's still so much that we don't know. And there's a lot that we're not paying close enough attention to.
All right.
Okay.
So, audience out there listening, what Dr. Thomas E. Levy keeps referencing about this 40%, that's a 40% increase in death for the working age group, 18 to 64 years old, and the CEO of a large, been around since 1877, this life insurance policy company called One America. The CEO announced that in the first 3 quarters of 2021, they saw an increase of 40% of more deaths for the working age group that were not COVID-19 like defined deaths, but it was like all-cause mortality deaths. So for all reasons, people were dying more often. And of course, this caught the attention of a lot of us because the majority of these people are probably vaccinated because as we're getting reports, 70% of America's gotten it.
Dr. Ardis and the life insurance companies went crazy and immediately said, no, you're not going to be able to collect on a life insurance policy if you die from an experimental vaccine. Exactly. They said the vaccine was not FDA approved, and it was in the life insurance company was terming it an experimental application, and quite deftly sidestepping what would have been an avalanche of claims that probably would have put all the life insurance companies bankrupt at the very least.
Yeah. All right. So I want to go to what are some of the current medical treatments that people are living on because so many people have blood clotting issues or thicker blood, and they call these things blood thinners. And about 2 to 3 million Americans, as we look at this slide, are prescribed blood thinners every year, anticoagulants, thrombolytics. Can you tell us some of the examples of the most common prescribed drugs for our audiences who would have parents, loved ones, or themselves that are being treated? What are some of the most common named blood thinners?
Well, the long-standing ones, and they're nasty drugs to have to take because you have to monitor them so carefully, and there's so many potential bleeding combinations, is the Coumadin or the warfarin. This is what people with mechanical heart valves have to take. Otherwise, they run a chance of those valves clotting off and having sudden death. But it's also used for other things like atrial fibrillation, where the heart is not contracting completely in the upper chambers, but just very irregularly, which causes areas of stasis, areas of slowed blood flow in the atrium, and is statistically increased with blood clots forming there. So that's another thing. Of course, there's the venous thrombosis that you talked about. All of those are indications for these drugs. And when the physician feels that what's going on is a lifelong situation that's not going to change or heal or resolve, then the recommendation is for these forms of anticoagulation to be given for life. Now, in the shorter term, when you have increased chance of blood clotting, such as after certain operations, post-operative, you can give low doses of heparin subcutaneously. You can also give it intravenously if you're in the hospital. And heparin is probably the best agent there is to prevent a blood clot from forming. If you have heparin in the blood at the right amount, no blood clot is going to form, period. But like anything else, it requires monitoring. And if you don't watch it carefully, heparin can cause bleeding too. But unlike the Coumadin or the warfarin, you can rapidly reverse the heparin anticoagulation if you overdo it. Now, they have some new agents. I think one is called Eliquis, which statistically appears to be have similar effectiveness and doesn't need quite the frequent checking of the blood thinning that warfarin and Coumadin do. And then you have other agents that are thrombolytic agents. In other words, streptokinase, nattokinase, different forms of uh, clot busting drugs that are given very cautiously when you know blood clots have formed and are in the process of forming. You do thrombolytic agents and they will dissolve the blood clots. Again, that has to be done really careful monitoring, because when you break up a blood clot, sometimes you break it into smaller pieces and then they go downfield and block off smaller vessels. But still, if you have a very large blood vessel blocked, you want to get that blood vessel relieved of significant blockage, regardless of what happens downfield. And then, of course, there's called the antiplatelet agents, okay? The other forms of clotting I was talking about is the body's main blood clotting mechanism, a whole series of proteins that forms the blood clot. Well, you have antiplatelet agents. Platelets are the small elements in the blood that can get sticky and then clump together and then promote the formation of a larger blood clot. So sort of the platelets work hand in hand with the rest of the coagulation mechanism to ultimately produce larger and significant clots. And this is the whole concept behind, for example, the low dose aspirin that has been recommended by internists and cardiologists for decades now as a preventative against your chances of getting a heart attack, because basically all heart attacks happen when a partially blocked blood vessel, but still open, gets an area that activates the platelets, and then the platelets clump up and then block off the rest of the blood vessel, stopping the blood flow to a certain area of the heart and causing a heart attack. So you have all these different things. You have the Coumadin and the warfarin. You have the heparin, the and the other forms of the antiplatelet agents. All of these things could be used in variation. And when you're doing preventative medicine, it's fine to do it at home. But like I said, when you're dealing with patients who already have blood clots, these are some of the things that have to be done under careful watch in the hospital. And I say that not having much enthusiasm any longer for people managing anything in the hospital that can be managed outside the hospital. We don't need to go into too much of a sidebar, except to say we have a large number of hospitals and pharmacies practicing medicine these days. And certainly when it comes to COVID, without the complications that I'm talking about, when it comes to COVID, I would steer clear of the hospital at all costs, because the hospital, most of the time, is an assurance that you'll no longer be able to get the therapeutic agents that you want. Ivermectin, hydroxychloroquine, intravenous vitamin C, hydrogen peroxide nebulization, hydrogen peroxide intravenously, ozone, biooxidative therapies, and monoclonal antibodies to a great degree as well.
Yep. In fact, the emergency use authorization, the FDA just changed their guidelines for being able to treat COVID-19 on January 24th, and they actually took away Regeneron from all United States and U.S. territories and other monoclonal antibodies. There was 2 forms they took away. I do want to speak to you just for a second. You talked about the hospital protocols. I will say the mRNA shots, per the American Heart Association in their circulation journal, published that the mRNA vaccines dramatically increase on November 8th. They said dramatically increases thrombotic events, blood clot disorders, cardiomyopathy, and other vascular events, which include strokes and heart attacks. This is what the American Heart Association published in their circulation journal. Remdesivir, a month earlier, which is the only current FDA-approved drug for all hospitalized COVID-19 patients still, and as of January 21st, it has now been allowed to be put out as an outpatient therapy and extended now to be given, get this, to 7-pound newborns and anyone bigger or older. They're going to PCR test, Dr. Levy, 7-pound babies who are born in hospitals. And if they test positive for COVID, they're going to infuse them inject into their veins remdesivir that is proven to cause, per the Cardiovascular Toxicology Journal in October, a month before the American Heart Association said the shots caused blood clot disorders. The Cardiovascular Toxicology Journal said that the actual remdesivir drug causes death of cardiomyocytes, and its cardiotoxic effect is even worse than the published or proclaimed side effects of chloroquine and hydroxychloroquine. So anyway, this is disgusting. These things in hospitals I would not trust. Don't do it. All right, so one of the things that I've recognized, Dr. Levy, is that as people get older or put on blood thinners, you will see that their skin will start getting like these red patches. And that's one of the ways I know they're on blood thinners, like Coumadin typically. And we have a slide here to put up a picture there. These are some of the known side effects you talked about, but there's multiple with the drugs. And one thing I love about Dr. Thomas E. Levy, he's got an appreciation for nature and using things naturally and dietary-wise that can improve the body physically within. But when I said about the arms, this is arms of an elderly person is on blood thinners, obviously. And I used to explain this to people. There's these little bitty blood vessels. You can correct me if I'm wrong because I'm a chiropractor. So this is how I explain blood thinners. That they have this side effect of crystallizing your arteries and veins over time, and your capillaries are really, really thin. And they crystallize first before the larger, bigger veins and blood vessels in your body do. And when people bump up against anything, those little fragile now capillaries that are like crystallizing shatter. And then you get these little bitty outpourings of blood right underneath the skin, and it looks just like that. And then I would tell people, the longer you're on those blood thinners, it's going to continue to crystallize at the same rate, the muscular tissue of your blood vessels. And over time, the risk will be those blood vessels, the larger ones, will start to aneurysm or expand. They may rupture, which would lead to internal bleeding and death. And this is one of the reasons why I don't promote the drugs. I know you don't either. For the short term, there's going to be emergencies where we need them. In fact, if there's those blood clotting episodes in hospitals that Dr. Thomas E. Levy was just talking about, and there's these certain drugs they can use and put in real fast to dissolve the clot, I'm confident that those things need to be used in emergency settings. But patients aren't being asked to live on those, not like blood thinners are. So anyway, I just wanted to share that with you. This is what I typically saw. And
an interesting thing too, Dr. Ardis, is in the pictures that you showed, those are obviously an elderly person. And in addition to just being old and having a lot of the tissues break down due to age, something else that not many elderly people do is take a good supplement regimen. Everything in that arm can be caused by a severe vitamin C deficiency, because vitamin C is critical to the production of collagen to keep veins and especially arteries strong and difficult to damage, because that's what the strength of the blood vessel is collagen and interlaced glycoproteins and other inside your blood vessel. So, and as a matter of fact, think about it this way. When you have somebody dying of scurvy, of course, is a severe body-wide vitamin C deficiency that the British sailors died of when they went off of England for months at a time. They die because of two things. They start getting infections and they start bleeding. And that's what happens. And you also have syndromes called like the acute hemorrhagic fevers, like Ebola, Marburg virus, and a few other things. What these things do is they consume vitamin C so completely and rapidly from the enormous oxidative stress generated by these infections that they induce an acute scurvy. And it's actually acute bleeding that ultimately is the immediate cause of death in people with these incredible vitamin C consuming viral syndromes.
Very good. All right. So thank you for warning the audience about Marburg virus. Dr. Zelenko sent me a text the other day, and he's like, be warned, the Marburg virus is coming. Don't forget zinc, he said. Don't forget vitamin C. Yeah, so we're going to preach it here too. All right, so we have about 14 minutes left on this live show. The 5 or 6 people, they're so excited. They got questions. We'll answer those here in just a second. There's a few things I want to speak to. At thedrardisshow.com, there's a few supplements that have nutritionally backed research studies proving they have the benefit to keep your blood thin and healthy, to keep you from clotting. There's a couple of these that have even been found to be effective even in surgeries. There is a substance called N-acetylcysteine, and they've done research studies with NAC and been able to stop blood from clotting even during surgery. That's how effective it is at keeping clotting from occurring. So NAC is beneficial. Selenium at 200 micrograms a day is beneficial to help stop blood clotting and thickening of blood. These are all beneficial. You'll see something on the screen. Here's a research study published about the thrombotic effects of SARS-CoV-2 and the benefits of selenium. This is just one of the many research papers we have. But I want you to know that at the drardisshow.com, we've got a selenium supplement. We've got vitamin C. We've got NAC. And let's put up the next one. There's a couple other nutrients here. I've got some other research studies. Let's show you what else is actually beneficial. All right, so this is vitamin D. We didn't talk about that yet, but vitamin D has been proven to be beneficial in the risk of thrombosis and increase of blood clotting disorders. I just wanted to make sure you had these references. These are beneficial. You can get some of those at thedrardisshow.com. Also, Dr. Thomas E. Levy talks about if you don't got root beer and you don't got these butterfly infusions for high-dose vitamin C, if you don't have those at home, I'm sure he's working on getting those and putting together a kit of root beer and high-dose vitamin C infusions at home that he's going to sell on Amazon until those are ready.
Total kit.
Yeah, the at-home kit with a YouTube video, instruction video on how to do it. But before those come out, he would recommend for sure, and I would too, lipospheric vitamin C, which can be found at Live On Labs, liveonlabs.com, LIVONLABS. So Dr. Thomas E. Levy can help you with that. Oh, before we even go any further, there's a couple things I want to thank you for, Dr. Levy, and for those in the audience that don't know, on thedrardisshow.com, he has helped create the first 3 10 for 10 segments. He's already brushed around these and mentioned them. Long haulers COVID, which we call chronic COVID, and myocarditis. And him and I together, so generously, we've already had 1,300 people download this in the first 4 weeks, which is phenomenal. There's one on how to beat myocarditis naturally, and our approaches as a cardiologist, as a naturopath, and then how to beat hypertension and also how to beat long haulers COVID. You'll find those underneath the shop button at thedrardisshow.com. There's just so much coming as an attack from spike proteins, vaccines, remdesivir, and protocols for treating COVID that there is a risk for blood clot issues, heart disease issues, and we want to try to prevent these as much as possible. And him and I both share the same thing. Nature wins without the horrible side effects and detrimental effects. And vitamin C is a big component of each of those. So please check those out. And please support me and Dr. Thomas E. Levy in trying to bring this education to you. All right.
Well, it's just like this too, Dr. Ardis. People don't develop a remdesivir deficiency, but they do develop vitamin C deficiency. So and when you restore the natural things you're deficient in, lo and behold, you're healthy.
That's right. And anytime you lose your taste, that is a true sign of a root beer deficiency. With high-dose vitamin C. Just so you know, I love root beer. You know, I grew up in and around New Orleans all the time, and Barks root beer was about the best tasting thing around there.
Started in Biloxi. That's where I was born. I knew Barry Bark.
Did you really?
Yeah.
Wow, that's amazing. I didn't even know there was a guy named Barry Bark, but that's amazing. I'm glad you knew him. Do you have like a life supply of Barks root beer?
No, unfortunately, I don't.
You don't have a friend and family's discount? Come on.
No.
All right.
But I did beat him in a tennis tournament, so good guy, though.
Oh, that's awesome. That's awesome. All right, so I think we have some questions we'd like to address. Let's see. Somebody in the audience has got a question, and we'll see who can answer this.
We do have some questions. And
this is Christina. Christina's on the mic, but not on camera. She's on the mic. Oh, wait, now she's on camera.
Okay. Thank you, Dr. Levy. That was great information. So we have a few questions. How is the blood affected if you receive blood from someone who was vaccinated? Does it have the same clotting issues as the vaccinated person?
What an excellent question. The most honest answer is I don't know. Okay, I don't know what the blood bank does to blood that does have some circulating spike protein in it. Do they have a treatment that knocks it out? I doubt it. My inclination, solely an inclination, this is just my gut feeling is that some people, and I can't tell you percentage or anything like that, but I suspect some people have had spike protein exposures with transfused blood, not only from some patients that have been vaccinated, but some patients that are largely over their COVID syndromes, and maybe they think they're, It's long in the past, and they still have spike protein as well. I don't know if the blood banks are doing anything at all to check for this. It's a very good question. I can't give you a definitive answer, but I'm suspicious that it's a reasonable possibility for some people.
Great question, too. Can I answer that real quick or address it? Stu
Sure.
Peters and I did a show on that about a year ago, and he asked me to talk about the blood supplies at the banks and any concerns we have around COVID. And I brought to his attention that the Red Cross is not accepting vaccinated convalescent plasma, which is the part of the blood that has antibodies in it. And I said, if the Red Cross has a problem accepting vaccinated plasma, I don't know why they're accepting blood, but if you're concerned about this, which I was, we talked about the actual steps it takes to actually have your own blood given and stored at the bank for any future emergencies and what that takes. In most blood banks, you can contact and say, what's the fee to actually store my own blood? For any surgery or procedure you have upcoming, it's actually, the stipulation is you at least need to actually donate 48 hours to 72 hours before the procedure. That's what I read up on. That's all I can speak on that because we don't know. Any other questions, Christina?
Does COVID itself create a high risk of blood clots?
Oh, Thomas E. Levy can talk on that. He wrote a whole paper on it. Orthomolecular.org. Okay, go ahead.
I don't think there's any question. Certainly, COVID itself vastly increases your chance of blood clots over somebody who doesn't have COVID because of what we've been talking about with spike protein binding ACE2 binding sites, particularly in the blood vessels. We don't know percentages, but we do have the slide that Dr. Ardis showed us earlier that shows that 60% of this one practitioner's cases of COVID had elevated D-dimer tests. And it's a clear-cut test. If you didn't have an elevated D-dimer and you get COVID and you have an elevated D-dimer, you've got blood clots. And more specifically, you've got blood clots that you're starting to break down because the D-dimer just measures the products of blood clots as they get dissolved. But either way, it's a direct indicator of increased blood clotting. So no, COVID is an enormous risk factor for blood clotting. Absolutely.
Great question.
Okay. I don't know if you guys are familiar with this, but Dr. Jane Ruby did a show with Dr. Hirschman, and he has discovered that there are fiber-like things attached to the blood clots. Are any of you familiar with
I actually watched the whole episode. Have you seen this, Dr. Levy?
No, I haven't. So you go ahead and field it.
Okay, so there has been this reported from not just one guy, not only just this guy. There's embalmers that prepare bodies for burials, and they're finding that when they go to inject the embalming fluid, they can't get it into the veins because there's all these blood clots in there. And this one guy went on Dr. Jane Ruby, Dr. Hirschman, is that his name? And I just watched it last night, actually, while I was texting with Jane Ruby. Another question. But he started to pull out these blood clots that where he could see them in the veins, there was that black oxidative looking blood clot. And then as he pulled it out, the whole inside of the vein came out with it. And the whole length of the leg vein was a clot. And the clot was black and reddish and purplish at the top where he extracted it. And then the length of the leg, the whole leg of this individual, there was a white fibrous-like continuation of the shape of the vein. But it wasn't the vein. It's just this fibrous-like clotting tissue that he even said after doing this for 30 years, he said he's never seen this before.
It was like a plaster of Paris cast. You brought out a perfect reproduction of the anatomical structure of the vein in the form of a big clot.
Yep. So supposedly these are being reported by embalmers around the world who are noticing this only in vaccinated people. They do find blood clots in people who are not vaccinated, but all the embalmers that are complaining about not getting the full amount of what the normal amount of embalming fluid would be, which I assume is, 10 pints like your blood. I don't know. But whatever that amount is, I've never embalmed anybody. Have you, Dr. Levy?
No, don't have any plans either.
Yeah, me either. All right. Any other questions?
One more. So someone unvaccinated donated their own blood because they were going to have surgery, heart surgery. And the blood clotted in the bag and was unusable. Is that common, or why would that happen?
Well, I tell you what, I'm not aware of anything or any circumstance or condition that can cause blood to clot when you put the appropriate amount of heparin in the bag. That sounds to me like an error on the part of the blood bank staff, not enough heparin, or they forgot the heparin, or I don't know. But if you put heparin, if heparin is in the bag in the right amount, when the blood comes in, even if you have a proclivity or tendency to have increased blood clotting, it's not going to clot if there's enough heparin in that bag. So I would think it's much higher likelihood that the procedure was mishandled.
All right, so I have a technical producer just put on the screen. Can I ask a question? Yes, you can, Mark. Go ahead.
Dr. Levy, my father passed away from something the nurses called Coumadin death. And he had a stroke, and it's a result of deep vein thrombosis. He'd become inactive because of a back injury. But there was a lot of chatter about perhaps he was on Coumadin too long. What can you tell families, what they should do to be looking out for that sort of condition? Is it common? Should we pipe down? What's your take on that?
Coumadin, well, I'm not saying it doesn't benefit some people, but it's a nasty drug. And it has to be monitored extremely carefully. Certain things, even when you get a stable level of blood thinning that you've determined with tests over time, sometimes the patient can inadvertently do something else that interacts with the Coumadin and either decreases or increases the blood clotting. So it's a very delicate balance. And it works best on people that have a very fixed lifestyle. They're not doing different things. And so once you get what's called prothrombin times at an appropriate level of decreased blood clotting, then it'll stay stable, but you still need to check the blood. I think most people will still check it like at least once a month, early on, much more frequently, but at least once a month. And maybe a practical point to take away from this would be for families to at least press their doctors. And some doctors are creatures of habit. They're going to do what they've done all along. They're not interested in anything new. The new drug Eliquis appears to be pretty much equally effective to Coumadin, requiring very little testing. And although certainly it's a
30
blood thinning drug
seconds.
and it could cause bleeding complications, it might be a good substitute that'll have less long-term complications, and they should discuss it with their doctor about changing.
Great points. All right, Dr. Thomas C. Levy, you're phenomenal. Can you please tell the audience where to follow you, where they can find your info, your books, because you're a great educator and researcher.
Well, the best spot is my website, peakenergy.com, peakenergy.com. We got a lot of articles there, links to all my books, and some educational things I'm doing down the road. So it's got a lot of information there. And I leave my email open, televymd@yahoo.com. Now, I don't do consults, and I'm not going to tell you how to treat yourself, but I can lead you in the right direction to get more information for whatever you're dealing with or whatever you're concerned about.
Thomas C. Levy, thank you so much, Doc. I really appreciate everything you've done. And for the audiences out there, remember, there's a 10 for 10 for myocarditis with me and Dr. Thomas C. Levy. Hypertension, how to beat it naturally, and then how to beat long haulers COVID. And we've already started the prep work to create the fourth one that's coming. And this fourth one's going to be on how to beat arteriosclerosis, which will include also some of these blood clotting issues we talked about and the natural remedies for that. So that will be coming here in the next week or two. We'll have that ready and finalized for you. It's our job to try to protect, educate, warn, and inspire you that life can be better. Dr. Levy, I hope you have a great evening there in Miami. And thank you so much for all you do.
Disclaimer, please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice, provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it. Do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.